CT versus ultrasound for diagnosing appendicitis. Episode. Contract Trial. 2021. What's the better test? Hey everyone. Welcome back. Today, we're diving into one of the hottest debates in emergency medicine. When you've got a patient with suspected appendicitis, should you reach for a CT scan or an ultrasound? Let's break down the contract trial from 2021. A multi-center, pragmatic, randomized controlled trial that puts these two head-to-head. Study designed. So here's the setup. Multiple hospitals, adults with suspected acute appendicitis, and they're randomized to get either a CT scan or an ultrasound to see which one nails the diagnosis better. Key findings. Diagnostic accuracy. First off, the numbers don't lie. CT came out swinging. We're talking about a sensitivity of 95.5% for CT versus just 76.3% for ultrasound. That means CT is catching way more true cases of appendicitis. Specificity? Pretty much the same for both, around 95%. So they're equally good at ruling stuff out. But get this, ultrasound had a 15% inconclusive rate, meaning in a bunch of cases, docs had to follow up with a CT anyway. Clinical outcomes. Now, what about those all-important clinical outcomes? Negative appendectomy rates. Basically, taking out an appendix that wasn't inflamed, were way lower with CT, just 4.5% compared to 7.5% for ultrasound. And when it comes to perforation rates, both methods were basically the same, so there's no trade-off there. Bottom line, CT missed fewer cases. Radiation exposure. Of course, there's the elephant in the room. Radiation. CT, as expected, has higher exposure, which is something to think about, especially for younger patients. Implications for practice. So what's the takeaway? For most adults, CT is the clear winner for nailing down that appendicitis diagnosis thanks to its higher sensitivity and fewer inconclusive results. But ultrasound isn't out of the picture. It's still a great first step for specific groups, like young women or pregnant people, where we want to minimize radiation. A stepwise approach, starting with ultrasound and moving to CT if you're not sure, might give you the best of both worlds. Conclusion. To sum it all up, CT is usually your best bet for adults when you want a solid answer, but don't count out ultrasound, especially if you're worried about radiation. Think about your patient and pick the tool that fits. That's all for today's episode. If you found this breakdown helpful, don't forget to like, subscribe, and hit that bell for more evidence-based content. See you next time on the Everything Surgery podcast. Dissect the extraordinary.